We are back with our regular segment each Tuesday from the good folks over at our local community hospital here, Saddleback Memorial Medical Center, and this segment brought to us by the foundation, of course, that helps support the hospital. Two of our guests today are some of the frontline folks you see at work over there at the hospital. We're joined today by Dr. Marc Taub, who's the Medical Director of Emergency Department at Saddleback, and RN Kristen Lawler. Welcome both of you to the show.
Morning.
Good to have you on the program today. Dr. Taub, recently you folks just got a nice, very significant designation. Stroke Neurological Receiving Center here in Orange County.
Yes.
Explain a little bit about that and how that would work with the average patient.
Okay. Well, basically, in the last few months, Orange County has put together a stroke system, much like we did for heart attacks in the last 5 years, and we've seen great success with that. So now with this stroke system, they have designated several hospitals throughout Orange County that are now specialized in receiving patients who are having a stroke. And so great for our community here is we have been designated, and so patients who are having a stroke in this area could be brought directly to Saddleback, where we can give them the state-of-the-art care and the best care possible.
So that would be somebody maybe would call 911, a family member or friends having a problem of some kind. We're not really sure what it is. Paramedics would say this person appears to have had a stroke. They get them in the ambulance and head towards the hospital, probably calling you folks on the way.
Exactly.
They get to the emergency room and you folks go to work.
Absolutely.
Yeah. We hear a lot about stroke these days. And there's a lot of things you can do, but I understand that the most important is that the patient get there quickly.
Well, true, yeah. Once you've already, the best thing you can do, of course, is prevent stroke
Not have
in the
the
first place.
right,
And
which we'll talk about in a minute.
We'll probably
Yeah.
talk about that. But
Yeah.
once you feel you're having a stroke, and we can talk about some of the symptoms too, the key thing is the treatments that we give for stroke are really based on treating quickly. And the sooner we treat, the better chance you're going to have of recovering from it. And also, the longer you take it limits the things we can do. So the main thing is if you feel you're having a stroke, you need to call 911 and get yourself to a hospital as soon as possible.
And if in the case where the individual is unable to even get to the phone,
Yeah.
It's better to take the shot on as a friend or a relative and give that call.
Someone needs to call 911, or of course, if you have medical alert or something.
Right.
Of that sort.
We've heard there's things we can do if someone's having a heart attack. CPR and those kinds of things. There's lots of classes for that. Is there really anything we can do if a family member or friend's having what we think is a stroke?
Not like a heart attack where you can give aspirin or CPR or things of that sort. In general, you're going to find someone who can't talk, can't move, things of that sort.
Yeah.
And so really the best thing you do is call 911. But if they're, for instance, on the floor and you're concerned they might choke or something of that sort, you could put them in a comfortable position just to make sure nothing like that
But get
happens.
that phone call in first.
The main thing is call 911 because once the paramedics get there, they'll call us, we'll get our resources mobilized.
And they have the
things
radio
going.
system and all of that.
Absolutely.
And then, of course, we have that new now medical center over there. A new part of the hospital is that emergency facility, which you head up. And obviously, instant analysis. Pretty much, you'll look at that person over pretty quickly if they take priority over the person with a broken finger or something.
Yeah, absolutely. Yeah, when the stroke patient arrives, we know ahead of time you're coming, and we actually call what's called a code stroke, and we're actually going to mobilize all sorts of resources throughout the hospital.
Yeah.
And when a stroke shows up, they'll actually be the most important person in our ER.
You mentioned there's some symptoms. Obviously, a person falls over, isn't able to talk, are some of the symptoms.
Well, the main symptoms you're going to see with a stroke would be, as you mentioned, unable to speak. Other things, real things you want to watch for is numbness or weakness involving one side of the body. If any of that happens, it's a very strong chance to stroke.
That's similar to a heart attack, though. We hear about people usually on the left side have some problems.
Well, heart attacks, you'll have often chest discomfort, shortness of breath, weakness, and you may have pain involving the left side of your body, but this is about numbness or weakness, paralysis.
Yeah.
And it's really one side of the body typically in most strokes you're going to see.
Okay. And of course, my understanding is it's the opposite side of the brain that's being affected, correct?
Yeah, that's interesting. So if you're having a stroke on the left side of your brain, it's going to be the right side of your body that's paralyzed. Yeah.
Right. And then, of course, we get them into the hospital and you folks go to work. Let's talk about some ways to prevent a stroke. And I know stroke education is part of what you do over there as well.
Correct.
As well as helping the doctors get the patients well.
Correct.
I guess there's some things we have no choice about. Our age, our gender.
Your age, your gender,
Our
your
racial background.
family history, those things you don't have a choice on. The things that you can modify, though, to prevent stroke are high blood pressure, cholesterol, heart disease, tobacco use, sedentary lifestyle. Correct.
Smoking.
Correct.
Smoking is okay.
It's a problem pretty much for every
We hear about it
disease
for
process.
lungs and heart, but it's potentially
Definitely,
stroke problems.
definitely stroke
A lot of good
too.
reasons to stop or not to start.
Correct. Obesity, and then previous stroke or warning or TIA, which they call a warning stroke. So any of those things that can be modified will help decrease your chances of having a stroke in the
Right.
in the future.
So kind of the same things for really good health is eat right, exercise, control the blood pressure, the cholesterol, all these other things, and
Correct.
chances are reduced. But if someone does have one, you folks are there.
And definitely get to the hospital as soon as possible.
Right,
Because
right.
time is going to be huge as far as
Right.
the treatment.
Best to use the ambulance or to drive the person?
Absolutely, you
Ambulance.
want to call 911 because we'll get a call ahead of time,
Okay.
which can get things rolling 15, 20 minutes before you even get there.
All right.
Yeah.
So if we see somebody that we think might be, they can't speak and seem to have the numbness or weakness, make that 911 call and then get them comfortable and open the door so the firemen don't break it down with an axe and let them
Definitely.
in.
What we use too is to educate the community is using FAST, F-A-S-T,
Okay.
which is face, if you have facial droop, or if your face looks twisted,
Yeah.
that's one of the symptoms. Arms, if they can't extend their arms and hold them up, if one droops downwards, that's another symptom. And then speech, if their speech is
Right.
slurred or if their words aren't making any sense, those are things that you need to call for quickly.
All right, very good. Some good tips as well. And then, of course, get the person stabilized. I know we hear about these clot buster drugs. Sometimes those can be used if it's early enough in the process.
Yeah, so once they get to the emergency room, the main thing is we're going to do a quick assessment. We need to get a CAT scan to see if it's a bleeding stroke or a stroke that's due to a blockage. And depending on the time frame, there are clot buster drugs that many people have heard about. Previously, it was up to 3 hours. Now we have, for most patients, up to 4.5 hours
Right.
now to give it. There are a lot of reasons why we can't give it. For instance, if you're on certain blood thinners, if you've had trauma to your brain. But if you can get it, we would definitely
Yeah,
like to give
yeah.
it to you. And it's a great drug that can help us out a
And
lot.
then following the stabilization process, in some cases, some rehab. If the person is somewhat impaired, then the rehab department takes over.
Yeah, a big part of stroke, first is getting that initial treatment, but after strokes, we want to prevent things like pneumonias, urinary infections, blood clots in the legs, all sorts of problems. So it's really important we give good, well-rounded care and then rehab in the end,
Right.
get people back to where they were when they started.
Right.
Yeah.
Well, obviously, none of us want to have a stroke or have our family members and friends have one, but it's certainly reassuring to know that your team is there standing by with the procedures and all. And again, I guess the bottom line is that call to 911 is critical in these cases. Right.
Definitely.
We thank you both for joining us today. Some good information on prevention of strokes and what could happen if you have one. Again, that great facility over there at the Saddleback Memorial Medical Center. Thank you both for joining us on the program today. We'll be right back with more as our program for Tuesday continues here on Channel 6. Stay with us.
From day one, it was clear this active retirement community needed a hospital.
And today, Saddleback Memorial, a nonprofit, state-of-the-art medical center, provides excellence in healthcare for you and for me.